GETTY STOCK IMAGEMRSA can cause a range of skin conditions and life-threatening infections. A study of almost 30,000 patients found those on the cholesterol-lowering drugs were up to 30% less likely to carry the bacteria which can cause the infection. Experts yesterday hailed the exciting possibility of statins offering protection from the bug. MRSA can cause a range of skin conditions and life-threatening infections. It is one of the most common bugs picked up in hospitals and can be lethal for patients with weak immune systems. The research found statins, especially among elderly patients with conditions such as kidney or liver disease, may be protective against the serious infection. GETTY STOCK IMAGEMRSA is one of the most common bugs picked up in hospitals. Our results indicate statins may have an important place in the prevention of bloodstream infection caused by Staphylococcus aureus, which would hold important clinical and public health implications. Dr. Jesper Schmidt, Aalborg University Hospital. Those on the cholesterol-lowering drugs were 27% less likely to contract the bacteria, rising to 30% for long-term users. As Britain's population is aging and more people live with chronic medical conditions, any potential preventive effect of statins could have important implications. Dr. Jesper Schmidt, of Aalborg University Hospital, Denmark, said our results indicate statins may have an important place in the prevention of bloodstream infection caused by Staphylococcus aureus, which would hold important clinical and public health implications. Statins, which cost a few pence, are the most commonly prescribed drugs in Britain, with 6 million people taking them. Friday, September 9, 2016, but they are controversial because they have been linked with causing muscle weakness. Other patients have also complained of muscle aches, memory loss, kidney problems and sleep disturbance. The latest findings, published in the journal Mayo Clinic Proceedings, analyzed records of almost 30,000 people in Denmark over a 12-year period. Researchers found that the more statins the patients were taking, the less likely they were to acquire the potentially lethal bacteria. Even new users whose first prescription for statins was within 90 days had a modest 4% reduction in risk. GETTY STOCK 6 million Britons take statin. Dr. Schmidt said the results called for more research on the protective benefits of statins. He added, our observations warrant confirmation in other settings that the biological mechanisms by which statin treatment may protect against this type of infection should be explored further. Dr. Daniel DeSimone of the Mayo Clinic in the U.S. called for trials. He said the work raises the exciting possibility the effects of statins may also harbor important antimicrobial effects that may exert a clinically relevant benefit. Trials in the case of statins are appealing because these drugs are relatively low cost, can easily be matched against a placebo, and would allow for enrollment at the time of an already necessary antibiotic prescription. MRSA lives harmlessly on the skin of around 1 in 3 people, and healthy people, including children and pregnant women, are not usually at risk of infections. It is resistant to widely used antibiotics. About 30% of people carry the bacteria on skin, or in the nose, without realizing. However, it can invade the body's bloodstream and release poisonous toxins. GETTY STOCK IMAGEMRSA lives harmlessly on the skin of 1 in 3 people. Statins are a group of medicines that can help lower the level of low-density lipoprotein LDL cholesterol in the blood. LDL cholesterol is often referred to as bad cholesterol, and statins reduce the production of it inside the liver. In most cases, treatment with statins continues for life, as stopping the medication causes cholesterol to return to a high level. Last month, a 20-year review by Imperial College London showed taking statins reduces the risk of premature death by as much as 28%. However, other studies have found that statins increase the risk of developing diabetes by up to 50%. Those on high doses of the cholesterol-busting pills are more prone to suffer dangerous spikes in blood sugar levels, an unwanted byproduct of the drug.